With COVID-19 cases on the rise, getting a test or getting the results back quickly can be tough.
Many hospitals say they're doing their best, but as FOX4 Sheree Honeycutt shows us, there are speed bumps.
COVID-19 cases are increasing on both sides of the state line. Hospitals are doing their best to keep up with the demand.
We are still seeing large volumes of patients coming in. Our inpatient volumes continue to go up.
St. Luke says they process about 800 to 1,000 tests a day. At the University of Kansas Health System, they're testing the same number of people daily, but say sometimes they can't do as many tests as they need because of lack of supplies.
We have had supply chain issues essentially across the board. So when this process started, we talked a lot about how we couldn't find the appropriate swabs. That continues to be a problem, but has been somewhat alleviated.
Rachel Leisman is the director of microbiology at the University of Kansas Health System. She says it isn't just a problem at their hospital, but everywhere. It comes at a time when Dr. Larson says a growing number of people are showing up to be tested because of symptoms.
And there are people that have been vigilant and they've been masked when they're out, but they've had short lapses where they went to a friend's house for dinner and one person had it and then all of them got it.
Both hospitals can get results back to most patients in a day or two.
We try to keep our outpatient turnaround time at 48 hours or less. This is important for patients. You know, we ask that they go and they quarantine, especially if they're symptomatic, while they wait for results. And so we don't want to force them to quarantine for long periods of time.
They say keep wearing a mask and washing your hands. It's the best way to keep you and others safe.
Kudos to the community for embracing some of the mask requirements on both sides of the state line. But people still have to remain vigilant and understand that the mask is one layer of protection for you, but it's not the end-all be-all.
Sheree Honeycutt, FOX4 News.